Everybody knows that obesity in America is a serious problem that we're dealing with. And here in Oklahoma, it's even more of a serious problem than it is in many parts of the country. We have the 6th worst obesity rate of any state in the nation. And we really wanted to dive into that and take a look at just what made Oklahoma so bad when it came to obesity. So we devised a 5-part project to kind of dig through the different layers involved there. Part 1 is what I like to call the scene setter. That's where we're kind of analyzing what is obesity, how bad is the problem here in Oklahoma? And the main question we're asking of elected officials and health officials in the state for Part 1 is, what difference does it make? What difference does it make if everyone is obese? Why is that a bad thing for Oklahoma?
Right now, taxpayers and companies pay about $2 billion a year in obesity-related health costs. And we've seen the state's diabetes rate also skyrocket. We've seen a high rate of other obesity-related diseases like heart disease. You've seen a rise in asthma and COPD. You've seen a rise in blood pressure, hypertension, and high blood pressure. And you've also seen a rising obesity rate among children and young adults, which I think is concerning for some state leaders who are concerned about what the future of health looks like in the state of Oklahoma.
We move on to Part 2, and we ask the question, how did we get here? Oklahoma was not always an extremely obese state. In fact, the country wasn't always as obese as it is now. So we talked to health experts and nutritionists to get a feel for what has happened in the past 20 or 30 years that has taken us down this road where we find ourselves now.
In 1990, Oklahoma's obesity rate was only about 10%, and today it's more than 30%.
In Part 3, we look at the human toll. Who's affected by obesity? Talk to people who have struggled to lose weight, people who have succeeded to lose weight. We look at childhood obesity and look at the emotional toll that it takes on people, not just the health toll, which there are many of those aspects that also merit looking at. In Part 4, we start to look forward. What can we do if we want to beat obesity? What can we do if we want to reverse the trend? Again, we talk to nutritionists, dietitians, health experts for some common sense approaches, some tactics that you can take, some things that maybe you wouldn't have thought of that you can apply to your own life if you want to win your struggle against obesity.
Governor Mary Fallin said a lot of things about health in her inauguration address, about a third of her speech, and really called on the legislature to take some action. In talking to people, one of the interesting things was hearing about how infrastructure changes can affect behaviors and help get people out of their houses and exercising more. That's something that Oklahoma City has definitely been working on with adding sidewalks, bike lanes, those kinds of things. But those infrastructure changes are also needed in rural communities. One researcher I talked with talked about the Tobacco Settlement Endowment Trust grants that they've given in communities, many of them rural, to make changes so that people can have options that are safe where they can exercise.
And then we finish it up in Part 5 where we try to tie it all together and ask the question, where are we going from here? If we don't do anything, if we stay on the trend we're on right now with a 33% obesity rate in Oklahoma, what will we look like in 30 years? How bad will it be then? And we hope to put an answer to that question of maybe we won't get to that point. Maybe we can make changes and we can improve our rate and reverse that trend. Health experts are working for that. They're pushing the public and the people of Oklahoma to make those changes. And so we felt like this was a great time at the start of the year to dive in and really examine obesity in Oklahoma.